Yeah. And here comes everybody. All right. Good afternoon, everyone. I think most of you know who I am. I'm Christy Schott. I'm the Continuum Care Program Administrator for the Bureau of Homeless Services. We are giving a very brief training today to all of the regional access points about the 1959I Medicaid benefit that will be rolling out July 1st. Each one of the regional access points will be part of the referral process, and we are putting together policies and procedures around what that is going to look like. And as Christy McDonald, who's going to do this training, says, you're already doing the work. We're just more formalizing the process of how to make these referrals. Christy, do you want to share your screen? Because you have the PowerPoint.
Yeah, I got it, Christy. And you essentially took like 3/4 of the PowerPoint and just set it all right there.
I'll stop talking now. Everyone, meet Christy McDonald. I'm sure most of you have met her. She is our newest addition to the Bureau of Homeless Services, and we're very happy to have her.
Newest addition, and I'm going into my almost year anniversary. So yes, very cool. So I'm here to just do a brief overview of the 1915I supportive housing benefit, and how the regional access points are going to be involved in that. 3 very simple objectives. What is it? When's it happening? And how are you guys going to be playing a part in it? And like Christy said, you're already doing most of it. She took my spoiler alert from me. So the 1915I is a supportive housing benefit, and it's a Medicaid state plan amendment that offers pre-tenancy and housing-related services that can be billed to a client's Medicaid plan. Oh my goodness, I was like, my notes are gone. Sorry, guys. We know that services like house searching, developing budgets, negotiating with landlords, all of those things are very important in getting and sustaining housing. And this is just going to be a way that we can have Medicaid pay for some of those services. So, big question, when is it happening? The amendment was originally approved by Medicaid back in 2022. It's 2024 now. So yeah, we've hit a few bumps in the road in implementation, but we're rolling. And we are currently on target for the benefit to go live July 1st, right around the corner. Oh my goodness, this is the old one. That's why it's not doing it the same way. It's fine, it's on me, not you guys. So essentially the eligibility criteria for the 1915I, a person needs to be homeless, at risk of homelessness, or have a history of chronic homelessness and a concurrent disability. And in the program, there are going to be 4 basic services. Housing stabilization services, there's going to be a transition service, which is getting someone into a new place. Sustaining services, which is keeping a person in a new place. Care planning, which is annually creating a plan to maintain everything. And therapeutic case managing, which is therapeutic case management. Oh my goodness, where are we? Sorry, guys. There we go. This is how it's going to flow, or at least what we're looking at for it to flow. The person who is experiencing homelessness, they use our process. They call 211. They get connected to the regional access point. At that point, the regional access point is going to complete an initial assessment, gather housing stability paperwork, the housing documentation, complete the disability paperwork. Remember, guys, stuff you're already doing. Then you're going to notify us at the Bureau. We're going to review that documentation, make sure that the person has Medicaid, and that's going to determine, we're going to be able to determine if they're eligible for the benefit. And then we're going to inform the regional access point that the person is eligible for the benefit. At that point, the regional access is going to make a referral to a provider of the benefit. So this is just kind of going over that. These are all of the things you're doing: the initial assessment, the documentations, all of that stuff. The referrals. So the referral, it could be to an agency that the person is currently working with. The weird example that we always come up with is Center for Life Management, because we know that they have both programs. So it could be that the person has case management through Center for Life Management, and they want to continue with housing stabilization services with them in the 1915I. They're going to just continue with that. It could be a completely different agency. Maybe they're not really keen on who they have it with, so they want it with someone else. That's fine. Or it could be that initial regional access point that is taking them through the referral process. There is a little caveat on that, and we can flesh this out a little bit more as we get into the program. But a regional access point can't do the annual plan and the housing stability services together. There's a conflict of billing interests, but we don't anticipate that happening frequently. Where the regional access points are going to be mainly focused is in that housing consultation services, the care planning, which again is just annual care planning, creating a person-centered plan, making referrals, monitoring and updating that, and it's done annually. And then,
Christy, hold on. Angie has a question.
Sure, go ahead, Angie.
My question is, with us here at CLM, Derek works with a lot of clients who come in who do not have Medicaid at that time. Is this something that can be backfilled?
That is a very good question, and we will have to find the answer out. And Christy is nodding and saying that I probably have the right answer on that one.
Okay.
Yeah, I'm not sure, Angie. We will take a look at that and get you some further information.
Yeah, but at this point, we've been working the flow and how all of the pieces are going to be working together. We wanted to get you up to speed. This is the reason that you all were invited to the Enroll as a Medicaid Provider training a couple of weeks ago, 2 weeks, I think, is so that if you aren't already a provider, actually, it doesn't really matter, because if you want to be reimbursed for 1915I services, you have to enroll as a 1915I provider in Medicaid. So we want everyone to be able to enroll as those providers so that you can get services and get reimbursed by Medicaid. But the one thing we want to know from you is, and we probably, although I sped through that really fast, might not have a lot of time to talk about like how you think it would be best to work through the process using the HMIS system, using encrypted emails, carrier pigeons. I'm not sure. I hear they're reliable. Anything else that I missed, Christy?
No, I just want to say we're working on developing those policies and procedures so you have a set, like, kind of referral process for the 1959I for each of the regional access points so that you know what paperwork needs to be completed, who to send it to, and the next steps after that. Some of you may become enrolled as Medicaid 1959I providers. Some of you may not, and we will work through that and figure that out with each one of the regional access points.
I have one more question. So I don't know if anybody else has experienced this with the regional access points, but we're getting a lot of calls from 211 for families who are at risk, but they wouldn't be eligible for Medicaid. How would that work with the billing process?
So if they're not eligible for Medicaid, I don't believe, and Christy or Greg, correct me if I'm wrong, I don't believe this benefit would work for them.
That's correct.
So we would
You
just
have to be yeah, you do have to be a Medicaid to have Medicaid.
So we just go about our regular business.
Yes.
Okay.
Yeah. But we're really looking at this benefit, hold on, mandate, so that we can really look at billing Medicaid for these services. And then for those of you who have other funding through the COC or ESG or whatever, you can use that monies towards serving participants in housing. So it will take us some time to figure this process out and to see how it works and get the kinks out. But I'm hoping this really benefits everyone so that you can bill Medicaid and get the Medicaid rates. Mandy had a question.
I do. Hello. I almost said
Hello.
good morning. Good afternoon. Young people tend to travel a lot, right? They tend to they move around. So how do we manage that? If they come in and we determine that they're 1959 eligible and one agency starts to bill, but then they move into like another regional access point area, or I don't know, for example, they go into like the Nashua continuum of care, which is one that we don't, how would that flush out? Do we have ideas?
I have some. So this is a statewide benefit. So it should go across all the COC lines. And so we should all be working.
Yeah, okay, but we could like refer to another 1959I eligible agency, because even though it crosses state lines, we don't necessarily have the services or the staff in those other regions. Do you know what I mean?
Yep. So you would do a warm handoff with that regional access point in that area, and then make sure they're connected to the right providers for the 1959I waiver.
Okay, thank you.
I said waiver. I'm sorry. It's not a waiver.
It's an amendment.
Yeah, I called it 1915. It's 1959I.
It's 1915I.
Oh, damn. All right, thank you. 1915I. Got it.
It's all
We'll
good.
get it right one of these days. It's fine. So we really just wanted to have this brief, like the quickest training ever, just to remind all of you, because you all work at the regional access points and this process is coming and starting July 1st. So we will be moving forward. We will get you policies and procedures as soon as possible for this. We are working on putting those together with the Medicaid team here at the state. And I see a lot more hands up. Hold on. Kelly?
Hi, I work with Angie here at the Center for Life Management. Is there an administrative rule that's already promulgated for this? That defines your benefit? Like, do you have a rule?
Working on administrative rules, but they may not be out for quite a while. And they're not going to require them for this, I guess, for quite a while. So they're going to be in the works, but there won't be any. And just a reminder to tell everybody, this does not, the 1959 does not cover deposits, food, furnishings, rent, utilities, room board, or moving expenses. So that's really important.
The administrative rules are coming, right, Craig? Eventually.
Eventually, a long time from now, yes.
But as most of you here are under contract through the continuum of care and the coordinated entry grants, you will be required to participate in this process. Mandy, did you have another question, or Angie? Because your hands are still up.
I did, I do.
Okay.
So, oh my gosh, I had two, but I can remember one. Is this going to be recorded so I can share it with the supportive services manager at Waypoint who couldn't be here today?
Yes, I
Rad.
recorded it. I remembered.
Yay!
I often forget. And Angie, did you have another question?
I do. So are there gonna, with the 1915I, is there like a specific number of units are allowed, or is it unlimited?
There is a specific amount of units as far as the housing stability, housing sustaining. Oh my goodness, Greg, help me out with the terminology. I put my thing down. The transition services and the sustaining services, I believe, are going to be 115 hours.
150 hours.
150
Right now-
hours.
Right now, it's coded as per diem, and they're trying to make it hourly. So they're trying to get through that whole thing. So that's another MMIS type of Medicaid thing they're trying to work out. But it's eventually going to be per hour. That's their plan. But right now, it's per diem technically.
And then the consultation is an annual thing that can be
Yes.
billed annually, and updated annually.
And so it's 150 hours per transition services, 150 for sustaining, and on request through DHHS, you can request more hours. I haven't quite figured out how that's going to work yet, but we'll worry about that when we get to that point. But right now it's 150 and 150.
Kelly, I have a question in chat about the fee schedule. We are just met with the Medicaid team this morning. And once we figure out the cost rates and how it's going to be billed for units or per diem, we will let all of you know. We have 2 months. We'll get you everything, I promise. Maybe. Does anyone have any other questions?
I
I will
just say, this is Kelly again. Can I
Yep.
just say one thing? I know you have 2 months. I think, by the way, you're doing a stellar job, but July 1st, like that, we need 2 months too.
Yes,
We
that's
need
why.
the same time as you need, with all the information. Like, we need to know the rates, and we need to know the codes, and we need to set up the mapping, and we need to do everything you need to do.
Yes, we are working as fast as we possibly can on all of that. Anything?
I think I saw Eric's hand.
Yeah, that's
up.
what I was thinking.
Yeah, I was late in here. I was in the lobby for a really long time, so I may have missed this, and I'll watch the recording. But is this going to be a separate project through HMIS, or is it going to be through coordinated entry?
It will be through coordinated entry. It will not be a separate project in HMIS. We are exploring the possibilities because our HMIS, the new system, can do automatic referrals. So we're going to be taking a look at that. But for now, we're going to set the process up that all the referrals go through BHS because we have to do several different steps. But you would just typically, again, Eric, you're going to follow the same process of entering people into coordinated entry, doing your coordinated entry processes. And then if someone is Medicaid eligible, getting them enrolled in Medicaid and seeing if they're eligible for this waiver through us.
So if I'm understanding you correctly, Christy, we have to wait for your approval of the referral before we can start billing, etc.?
Yes. It's my understanding of the way that it's going to flow is everything is going to have to be pre-authorized for Medicaid to pay for anything. So we're going to have to determine that they're eligible, get it pre-authorized, let you guys know, and then services can begin.
Yeah, so Angie, that kind of answers your question, I guess, now that I think of it, what Christy just said, because even though Medicaid's been able to be backed up 90 days, this has to be pre-approved ahead of time. So you can't really do anything in the background while we're waiting for Medicaid to be approved, you know?
Christy, you're muted if you're talking.
Eric, did you have another question?
Nope, sorry, I'm on the road.
It's okay. I just wanted to check. So we will share the PowerPoint with all of you, and I did record this training. So we will send that out to all of you afterwards, and we will get you guidance as soon as humanly possible. At least like detailing out what the regional access points need to do and how this process will work. And I understand the urgency because you also have to put things into place in your own agencies in order for this to happen, even though you're already doing all the work. All right. Well, I hope everyone has a wonderful Thursday. And if you have any questions, please reach out to either myself, Christy McDonald, or Greg, and we will do our best to respond to you with any questions about this benefit.
Thank you so much.
Thanks,
Thank you for
guys. Bye-bye.
coming.
Bye.
Thanks, everyone.
Thank you.
Bye, Patty. Bye, Patty. Trying to stop the recording. How do I do that? Stop. Okay.